Hello and welcome to a discussion of pathology of the hand and wrist. So in this lecture, we will discuss 12 pathologies that I need you to know, including 2 fat pads. And fat pads aren't pathology, but we're going to review them in this lecture to make sure you're comfortable identifying them. Let's get started. Our first pathology is called a Barton's fracture. And a Barton's fracture is a fracture of the posterior lip or aspect of the distal radius. So let's look at our wrist here. This is a right wrist. Here's the thumb. Here's the fifth metacarpal. And you can see here's the radius. There's a fracture here and extends here as well. And if we were to do a lateral, you would see that this is the posterior aspect of the bone, which is fractured. So a Barton's is a fracture of the posterior aspect of the distal radius. Next, a Bennett's. Bennett's is a fracture of the base of the first metacarpal. And again, I like to think of this as the base of the thumb. This is our first digit. So here is your Bennett's fracture right here. Okay, so be able to distinguish between Barton's, which is the radius, and Bennett's, which is the first metacarpal. A Boxer's. A Boxer's fracture is a fracture of the neck of a metacarpal. So remember, and we just saw this with the Bennett's, the base is here, the body is in the middle, and then the head is more distal. Well, the neck of the metacarpal would be just below that rounded head. Okay, so a Boxer's fracture is when you fracture the neck of a metacarpal, and we see this most often in the fifth metacarpal. So here you have your PA projection. You can see the fracture of the neck of the fifth metacarpal. Here we've got our oblique. I know this is an oblique because of the narrowed spacing in between the metacarpals. And again, here is our fracture line. Again, this can occur at any metacarpal, but we most often see it in the fifth. This type of injury is as a result, generally speaking, of punching or hitting something. A Colles fracture. Colles is a fracture of the wrist, distal radius in this case, with posterior fragment displacement. So here's your PA, here's your oblique, here is your lateral. Notice the fragment displacement is the key term here. So here's your lateral, here's your anterior, here's your posterior. The fragment of the fracture is displaced posteriorly. So we're not looking at the radius and the ulna, we're looking at the fragmented fracture. Okay, so Colles goes posterior. Ewing's sarcoma. This is a rare type of bone cancer that affects children and young people most often. You can see here we've got some osteolytic lesions in the third proximal phalanx. And what we mean by osteolytic is that this is a destructive bone process. It is taking away from the bone density and making it more radiolucent, the bone. So you can see some of the spaces here. This middle phalanx appears to be almost completely disintegrated, and then you've got a large tumor here. Certainly at this point we are worried about metastasis to other locations in the body. Whenever you hear the term sarcoma, that should be a red flag that is malignant. Okay, here's our fat pad, first fat pad question. So this is a lateral wrist. What is the name of the fat pad that sits anterior to the distal radius? If you said pronator fat pad, you are correct. Good job. All right, next, gamekeeper's thumb. This is a ligament injury of the first proximal phalanx, so again, your thumb, and it may or may not include a fracture. So here is the fracture on the first proximal phalanx. And the name gamekeeper's thumb actually originates from when people who raised or caught rabbits for food would hold the rabbit in such a way to euthanize it that it would injure their thumb. And that is a nice way to describe that process. So it can also be called a skier's thumb. Gamekeepers isn't that common anymore. So skier's thumb is another name for this. So it's a ligament injury to the first proximal phalanx with or without a fracture. Next, a mallet fracture. Again, this is an injury to the tendon where you may see a fracture to the distal phalanx. And you see this, here's your fracture. You see this a lot in athletes who maybe a ball hits the end of their finger, and I don't know, a basketball, baseball kind of jams their finger. You'll see a tendon injury, and then sometimes you'll see this fracture, and we call that a mallet fracture. Again, it occurs at the distal phalanx of any finger. Osteoarthritis. Another name for this is degenerative joint disease. And in degenerative joint disease, this is something that can happen as we age. You'll see a couple key characteristics. First of all, no joint space. So notice in some of these more, the dip joint here, there is like no joint space left. It's really just bone on bone. And you can imagine that that's painful every time you move your hand. You'll also see what we call bone spurring. Bone spurring is when you get these extra little pieces of bone. It's literally a little spur coming off the bone. And that is very characteristic of arthritis. So you can see these bone spurrings here. And you can get bone spurs anywhere in your body. We'll see them in the spine sometimes. So again, a bone spur is a clue that that patient can have arthritis. Osteomyelitis. This is actually a bone infection caused by a bacteria that has been introduced into the bloodstream. And you can see this second metacarpal here it just looks different, right? It looks kind of more dense, it's more white. This bone actually has an infection, and that is called osteomyelitis. So we actually do x-rays fairly often to look for osteomyelitis, again, which is a bone infection caused by a bacteria. Rheumatoid arthritis. So this is another form of arthritis. This tends to be more hereditary. This does not happen to everyone as we age, as compared to osteoarthritis. So this could be described as chronic bone erosion. Women are 3 times more likely to have rheumatoid arthritis than men. And you can see characteristically, see how the fingers kind of all point laterally? That is a characteristic of advanced rheumatoid arthritis. But you can certainly see rheumatoid arthritis in any part of the body. And, if it's caught early, you can intervene with treatments, but there is no cure for this and can be quite painful for patients. All right, here's another fat pad question. Here is a zoomed up close view of a PA wrist. And what I'm looking for is the name of the fat pad next to our scaphoid here. And that was a big hint. That is the scaphoid fat pad. Very good. All right, a Smith's fracture. A Smith's fracture is the opposite of a Colles. Remember a few minutes ago we said a Colles, the fragment is displaced posteriorly. In a Smith's, the fragment is displaced anteriorly. And you really only see that on the lateral. So here's your PA, here's your lateral. Again, I'm looking at the fragment of the bone is displaced anteriorly. Okay, so it's the opposite of a Colles. Paget's disease. This is a disease that can occur anywhere in the body. It is the abnormal breakdown of bone followed by abnormal regrowth. So the body will try to repair that abnormal breakdown of bone by supplying it with extra calcium, right? You can see that here. This third metacarpal is much bigger and denser than the metacarpals around it. The problem is that Paget's disease, that piece of bone that's affected, is never really going to be nice and strong because that breakdown process is always still occurring in the body. And again, this can occur in the pelvis, in the skull. This is different than Paget's disease of the breast. That is a cancer that affects the nipple in a breast, so that is different. But Paget's disease of the bone, just please remember, it's an abnormal breakdown of bone followed by abnormal regrowth. Okay, that is the end of our pathology presentation. We will practice with this in class, but if you have any questions, please let me know.